Good evening. I'm Mayor Ron Nirenberg with Bexar County Judge Nelson Wolf. We're joined tonight by Deputy Director of Metro Health, Jennifer HERRIOTT, and this is our COVID-19 update for the San Antonio community. Tonight we're reporting 222 new cases of COVID-19 in our city, which brings our total to 46,663 since the pandemic began. Our new 7-day moving average is 168. So this is a reminder again, just as we see those numbers volley back and forth a little bit, not to let your guard down, that this virus is still very prevalent in our community. We've still got to work together to bring it under control. We have 13 new deaths to report this evening, bringing the total to 822. 5 are the result of Metro Health reviewing the death certificates from the state and confirming that those deaths are COVID-related. Those occurred between June 26th and August 28th. And please keep in mind, every one of those is a family member or a loved one lost, and please keep them in your prayers. Tonight, there are 366 COVID patients in the hospital. That's down 20 from yesterday. 39 new admissions to the hospital that are COVID-related, 157 patients in the ICU, and 93 on ventilators. In terms of capacity, 65% of ventilators are available, as well as 14% of staffed hospital beds. It's Tuesday, so we are going to provide an update on the indicators we're using for tracking schools. The risk level of in-classroom learning is calculated by looking at the positivity rate, the doubling rate, and the 2-week decline in cases of COVID-19. This week, the positivity rate improved again to 7.8%, but we're still above the 5% or less that we want to be at for in-person schooling. The doubling time, which is the number of days it takes for the total cases to double, increased to 65 days, and we're no longer seeing an exponential spread of COVID-19. Finally, the 14-day case curve continues to show a steady decline, but we want to see a steady decline without rebounds in cases. And with that, the school indicator bar remains in the medium risk zone, the yellow zone you can see there on your screen. And that provides guidance for some in-person instruction, which is suggested to be of no more than 6 students in a pod, with a maximum room occupancy and building occupancy of 25%. Students and staff should still wear masks and practice physical distancing. Let me turn it over to Judge Wolf.
Yeah, we're only, 6 days away from first in classes in San Antonio area anyway. And so we have a little bit more time to continue to bring down that rate. And then we'll have a report next Monday or so that will also take the next cycle in about how we're doing. So we need to be prepared for it, and I think our schools are. Let me thank Sandy Wolf for giving this to me. It's from the leadership class of 45. They're celebrating a military class day this week, and I thank them and thank them for saying good things about our military. We really appreciate the military, and particularly what they did for us and as we face this COVID crisis. We did a couple of things today in court. There's a UVC, and I think I'm saying that right, UVC light fixture that you put next to your air intakes. And what it does, it kills any virus that may be coming through your air system. And you know, within a building, that's one of the dangers, is the airflow within a building. It's about a $1.7 million expenditure, and we'll be installing that in all of our buildings. We hope to have them all completed by December of this year. So any business or public entity that takes that step, that it certainly helps a great deal, whether it's for the COVID or we get past that, or whether for some other kind of virus that may be coming in. We also approved the expenditure to pay for mailing an application for a ballot, a mail-in ballot. We approved that today, and hopefully they'll be going in the mail pretty soon. So if you get one of those, this was to 65 and older, if you get one of those, you certainly may want to take the opportunity to go ahead and use that mail-in ballot rather than coming to the poll yourself. And the sooner as you get it, the sooner that you can fill it out and get the information in, the better it will be to make sure that we have the delivery of it. So we're on the right road, Mayor, and let's just hope we can keep it up.
Yeah, great. Thank you, Judge. And we are. And please do heed the warnings from our public health professionals. We need to see those numbers in the right zone before we can begin to really relax, and that won't be for some time yet. We also want to make you aware that Metro Health has seen some potential for scammers posing as contact tracers. We've gotten some reports of that. So remember that Metro Health staff will never ask for your social security number and personal banking information. Most importantly, staff will not ask for a payment. If you've tested positive for COVID-19, Metro Health will ask you to provide information such as your name, date of birth, address, and where you were to help in the notification of people who might need to be quarantined to stop the spread of the virus. But again, Metro Health will not ask for information such as social security numbers or personal banking information. If you were a contact to a known case, a staff will contact you to inform you of this potential exposure, explain the importance of staying home during the days you could develop the infection, and how to contact us to be tested. So again, please be aware that as always, there are people who will take advantage of a crisis, and that's no different during COVID-19. Want you to have the information to protect yourself. As always, you can subscribe to the latest on COVID-19 in our community by texting COSA-GOV to 55000. You can also get more information anytime at covid19.sanantonio.gov. Jennifer, myself, and the judge are available for questions.
Is there any explanation on why the cases went up so drastically compared to yesterday's new cases?
We seem to see an increase after a weekend in cases. So what I can tell you is that we are reporting all of the cases that we receive from labs. We are reporting those out to you all. So I think it may be a weekend issue with the labs.
In terms of nursing homes and other facilities like that, is there any update on that?
I don't think we have any update other than what was provided yesterday. I think the newest location is the Applewhite facility, which is a detention center. So we do have about 5 locations that we've added to the list, and we've taken a number off.
We have a text question from Erica Zucco at KENS 5. It appears that the CDC issued an order today temporarily suspending evictions through December 31st for renters unable to pay because of the pandemic. What does this mean, if anything, for San Antonio and Bexar County renters and property managers?
If it's
go
true,
ahead,
it's good
Judge.
news, but I haven't gotten information about that.
Yeah, you know, the question I had when that came out, is that relating to government funded projects? You know, I don't know that it relates to all the rest or not. But in any event, it's a good step forward that they're doing that. You know, the Supreme Court here in Texas stopped us from doing it for other projects, so I'm not real sure exactly what that applies to.
A woman died between the age of 0 and 19. Can you tell us if that's 0 to 10 or 11 to 19?
I believe that was a 15-year-old female.
We have a text question from Emily Eaton of the Express News regarding a police matter. Mayor, as you may have noticed, the body camera video that was released today does not show the 2-minute time frame where officers used force to place Mr. Ometu in the back of the police SUV. It appears as if the body camera fell during the encounter. Do you think additional footage from the second officer should be released, and if so, what will you do to facilitate that?
Yeah, I'm not sure it will. I don't know if we need any more confirmation on what occurred than we already have. We know there was a struggle that ensued, and Mr. Ometu was detained after it. You know, let me just say I'm glad about the focus on a just resolution. I think what the DA did today was appropriate. And I was pleased to see the officers also ask for the charges to be dropped.
I was real pleased that district attorney moved very quickly on this case. He didn't drag it out. They got the video. He made a decision, and a good decisive decision, and support him 100%.
Jennifer, how is contact tracing going so far?
It's going quite well. As you know, that's something that we've got the state working on for us. But we are able to reach 90% of the individuals, or the contract that we have with the School of Public Health requires them to reach 90% of the individuals within 24 hours. And based on a conversation I had just earlier with Dr. Bridger, they're meeting that requirement.
Is Metro Health working with any local universities with contact tracing?
We are working with UTSA to, they actually decided to host a contact tracing class. They've got about 20 students enrolled, so we're working closely with one of their professors so that they can actually do some of the contact tracing themselves and learn about the process and interest in public health.
How will that impact our community, having them participate in this contact tracing?
Basically what will happen is when a individual, a student tests positive, then we'll work with that class and those students, and specifically the professor, to make sure that they can then go ahead and contact the contacts. So they've gone through some training. They're actually undergoing that training right now, and we feel like it'll be an exceptionally rich learning opportunity for them.
Thank you.
Thanks.